the dementia awareness training, I think, is a really big step because for people that we've spoken to so far, like there isn't actually a lot of that necessarily happening on a regular basis across optometry practices in Australia. So that's like a big step, but also the built environment can also be quite an important part of that dementia-friendly experience. And having somewhere a bit quieter can make a real difference. Being able to turn down any background music, or if you've got a TV in the waiting area, having space for somebody to accompany that person living with dementia in the clinic space and in the waiting area.
Welcome to The Focused View, the podcast for eye care professionals across Australia. Brought to you by Opticare. In each episode, we bring together leading eye care, optical and business professionals to share valuable insights, practical tips, and the latest trends shaping the optical business landscape. I'm your host, Michael Nasser, and together we'll explore innovative strategies for practice growth, patient care, and business success in the eye care industry. Whether you're starting your career, managing a practice, or just looking to stay ahead of the field, The Focused View is your source for inspiration and knowledge. Marianne, thank you for your time today and welcome to the show.
Oh, thank you very much for the invite. It's a real pleasure to join you today.
By way of introduction and to formally introduce you to the guests and to our listeners, can you tell us a bit about yourself, about your background and what led you to focus on the topic that we're discussing today, which is eye care for people with dementia?
Yeah, absolutely. So I'm an orthoptist and we're quite a small profession in the eye care world. I think there's about 12 optometrists for every orthoptist in Australia or something like that. So I did my orthoptics training in the UK, and for orthoptics training there's quite a heavy focus on binocular vision and eye movements in our training. So I had some great lecturers who were undertaking their own research to really get into the nitty-gritty of why two eyes are better than one and what binocular vision actually does for us in terms of our day-to-day lives. So that's a bit about my background. So I'm an orthoptist and a bit of a self-certified binocular vision nerd, essentially. Why focus on dementia care in optometry? That's kind of the next part of the question. And it's kind of a tale of two countries, really, because in the UK, I conducted a research study that was looking at binocular vision in people living with dementia. And as part of this, some of the people who took part in my research shared their experiences of having their eyes tested. So this is both in the hospital eye care system and in community optometry. Some of these stories took place. And it was a bit of a mixed bag, to be honest with you. Some of these people just didn't really want to go through it again. So because they had a great experience and they didn't want to go back and have their eyes tested anymore. And so I was listening to these stories and just thinking, gosh, we must be able to do something about this to make this better. And around about that time, I received a job offer to move from the UK to lovely Melbourne to do clinical eye care research. And that was a really unique joint post between the Australian College of Optometry and the Optometry School at the University of Melbourne. So that was a chance really to be able to do research that matters to patients and clinicians alike, really. So this research is what I was fortunate to be able to do, this research about dementia care in optometry. And that pretty much brings me to where I am now.
Yeah, and definitely a topic that probably isn't spoken about in a way where we refer to it the way we are today, but I think a really important topic, because I know even in discussing with a couple of people before today's episode that I was doing an episode on eye care for people with dementia, and they're like, oh, they've all got experience with it. Now, these are optometrists and dispensers, and I've never thought about how we approach this. So I'm really excited to talk about these topics today, or this topic today, and also, I guess, explore what this could mean for a practice and how a practice can start thinking about this in a strategic manner to ensure that, I guess, they're providing the best possible care to people with dementia as well. So if we get going on that journey, what motivated you to start researching dementia and its impact on visual function? Was it something that came to you naturally? Was it an experience with family, or was it with friends? Or how did you get to that particular point?
Yeah, absolutely. So I think the point that you made there about that, I hadn't really thought about that kind of moment. That is definitely like when I've been presenting this work in various places, we all see people living with dementia. It's there in our communities. And actually, the story of how I got into dementia research is kind of the flip side of that in a way. So basically, the binocular vision research that I was doing in the UK was because of my clinical background. So the chances of having difficulties with our eyesight obviously increase as we get older, and this is why we see a lot of older adults in our day-to-day practice. But that does also include the likelihood of developing binocular vision problems. And so if you have problems with that, it can obviously impact upon your depth perception, and that in turn can increase your risk of falls, which are obviously not great for older adults. If you fall, you get fractures. If you get fractures, you can lose some mobility. It can maybe mean that you might not be able to continue living at home anymore. We really the whole eye care profession has a bit of a responsibility in that regard for falls prevention. And, that applies to the sort of dispensing of glasses as well as the, making sure that everybody is having regular eye tests as they get older. And so, I saw and treated many older adults with binocular vision problems during my hospital work in the UK. So I worked for the UK National Health Service for quite a while. But the thing that really kind of struck me when I was moving more into full-time research and I was working with nurses and doing research on long-term conditions was that when I was practicing, I didn't actually see that many people with dementia or quite significant cognitive impairment. In the UK, you can't access an orthoptist usually without a referral from somewhere, like a referral from a GP or a referral from an optometrist. And so when I was just sort of reflecting back on it, I was just thinking, well, where were all these people with dementia? And so that kind of led me to look into the topic a little bit more, because around about that sort of time, my own grandmother was starting to develop the kind of early signs of vascular dementia. And so, I just discovered that there wasn't actually that much research about eyesight and eye care for people living with dementia. There was not really a lot out there to really know about whether their eye care needs were being met. And there was even less research about things like depth perception. Now, anecdotally, difficulties with judging distances is actually like a fairly commonly cited aspect of living with dementia. There's these sort of fact sheets online from the sort of dementia charities about dementia and sensory perception, and that topic of judging distances does actually come up like a reasonable amount. And so that was what really started me into the world of dementia research, was that topic of, well, what is the depth perception of people living with dementia like? So that was what prompted the very first research project that I did.
And can you share some key insights and findings from your research on depth perception and dementia? And I feel like you started that, you're still obviously championing that message. So it's something that still continues to this day. So those insights and findings have obviously been quite significant or significant enough for you to continue on this journey. So can you share what they are and to the listeners to make it aware for them what you've found and your findings in this regard?
Yeah, absolutely. And so in a lot of ways that we do these things, you do research to back up the stuff that you've kind of observed. Right. And so these anecdotal reports of difficulties with depth perception when you have dementia are true, but they're not true in all cases. So what we found was that, because we did a full orthoptic workup for these research participants, so we looked at the depth perception, their ability to move their eyes around, their level of vision, and the level of contrast vision, all of that sort of thing. And so what we found was that not everybody living with dementia actually has problems with depth perception, but it's not uncommon either. So we found about 67% of the group of people. It was a fairly small sample because we were testing them every 3 months or so over the course of a year. So we had about 24 people that took part. So very much an exploratory study, but we found about 2/3 of that group had depth perception that was lower than what older adults without dementia would score on the same depth perception test. And then for that group as a whole, of the people with reduced depth perception test scores, about 1 in 5 had depth perception poor enough that they would be considered at increased risk of falling. So basically, binocular vision and depth perception problems are not uncommon in people living with dementia, but there's only a certain proportion of people that actually have reduced enough depth perception. And this is brain related, right? So this is the parietal lobe of the brain that processes all of our kind of spatial vision bits and pieces. And that can be affected in dementia, which can then have a knock-on effect on your depth perception test scores. But for most people with dementia, the depth perception is reduced compared to older adults with normal cognitive test scores, but they might not necessarily have depth perception that is reduced enough that you would say, oh no, you're at increased risk of falling, you need to be careful. So essentially, one of the other key takeaways from that piece of work was actually we included people with quite a wide range of severities of dementia. So some of the people that we tested had quite low cognitive test scores. And even though they did have quite a significant amount of cognitive impairment, to the point where they were sitting in the middle of the room with me and saying, well, why am I here? What am I doing at the moment? And I had to sort of just kind of reorient them to the fact that they were taking part in a research study and having their eyes tested as part of that. With the right support and demonstrating the tests, even some of these very subjective tests of level of visual function, they were still able to do. All of our depth perception tests are subjective. And so with the right support, they were still able to do them. Like, I didn't have a single person in my research participant group who was completely unable to do any of the vision tests.
And that's a good theme to pick up on for the next part of our discussion, because what we want to look at here is obviously understanding, what dementia is to some extent in its relation to optics and what we do in our industry. But we want some practical solutions for practices to make them more friendly with regards to treating and assisting people that do have dementia. And you've just mentioned there, even in your testing scenarios or when you were doing your research, you obviously took the time to ensure that you would get the best outcome for them and for yourself, I imagine, with reiterating and reintroducing to where they were and what they were doing. So what are some practical solutions for making an optometry practice more dementia friendly?
I think the number one thing is making sure that everybody who has contact with customers at the practice has done some basic dementia awareness training. So the best thing that we can all do as eye care professionals is to see beyond dementia to the person. Person-centered care is what we pride ourselves on. And so having a little bit of understanding about what dementia is and what it's not is kind of the least we can do, really. And you can actually there's a company called Dementia Training Australia, and they have free online training about dementia. So you can go online and do their dementia discovery course for free. And some of the modules are just 15 minutes long. And even just doing a few of these can help you to understand dementia a little bit better. Because, as you say, we see people with dementia in our day-to-day practice often. We might not necessarily know that they have dementia. They might not necessarily know that they have dementia. They might have those early signs of cognitive impairment, but not necessarily have gone down that path of getting a dementia diagnosis. But regardless of whether or not they do, the least we can do is have that understanding of how cognitive impairment can actually impact upon your day-to-day interactions with that person in the optometry practice context, whether you're the optometrist doing a test or an optical dispenser providing customer service and helping to pick frames. We've all got a role. We can all sort of step up. Actually, a lot of common sense, quite practical, down-to-earth stuff that might seem like small things but can make a world of difference. The dementia awareness training, I think, is a really big step, because for people that we've spoken to so far, like, there isn't actually a lot of that necessarily happening on a regular basis across optometry practices in Australia. So that's like a big step, but also the built environment can also be quite an important part of that dementia-friendly experience. And having somewhere a bit quieter can make a real difference. Being able to turn down any background music, or if you've got a TV in the waiting area, having space for somebody to accompany that person living with dementia in the clinic space and in the waiting area. Accessible rooms are obviously a bit of a given for the vast majority of practices, but also if you have a separate testing room for diagnostic equipment, for example, maybe you might be able to have that person sat in just the one chair and be able to bring the equipment to them rather than constantly shuffling them around from one chair to the next, up, down, especially if they have a coexisting mobility difficulty, for example.
Yeah, I think alluding to the layout is important, and I definitely want to see if there's any other thoughts you have on that. But the awareness factor, I think, is the most critical, I think, in this instance at the moment. It's do you know? Are you aware of what dementia is? Do you know how it might affect an individual? You obviously pointed to some training that can be done online for free and quite quickly. We'll definitely have links in the show notes for that. So if anyone's interested in exploring that and starting that particular journey, I think it's really critical, because I'd imagine if you go into most practices, not all, but most, and you were to say, do you know which one of your patients have dementia? How many would actually know? I'm not sure if you've got any experience with any surveys or any tests that you've done along the way with practices to see if how common it is in terms of it being picked up. Is it something that you see often, or is it probably not as common as one would think?
The research project that we did here in Australia, which was looking at the experiences, the routine eye test from different perspectives, people with dementia and supporting carers and optometrists as well, that sort of told us that actually knowing about the dementia diagnosis before the person comes in for their appointment is the exception rather than the rule. But there can sometimes be some helpful tips that can sort of indicate that there might be a dementia diagnosis in the mix. Now, I think it's really important to say that actually people living with dementia experience a lot of stigma in their daily lives, and that can actually lead to them having quite negative experiences with healthcare professionals who don't have that knowledge of dementia and how that can interact with, for example, communication and ability to follow instructions and making decisions about things. And so that can lead to some people actually feeling a little bit uncomfortable around people living with dementia, being unsure about how best to interact with them. I think it's important to have that understanding of why people living with dementia may choose to not tell you that they have a dementia diagnosis, because there have been instances where people have disclosed that diagnosis and then their interaction with that person has then gone on to be negative, because that person has then reacted quite poorly to that and gone, oh, well, I don't really know what to do with you. I don't really know how to talk to you, because now that I know you have dementia, my view of you has then changed. So there's a lot of assumptions and misconceptions about dementia that can affect those interactions. So it might be that they've had a negative experience in the past with disclosing their dementia diagnosis to a healthcare professional. They may be unsure about how disclosing that diagnosis is going to actually change their experience when they visit the practice. Like, what's the benefit? How is that going to do anything for me? Or they may simply just assume that you already know, like they've told their GP, and therefore they just assume that there is some kind of cascade of information going on, which often there kind of isn't, unfortunately. But whatever the reasoning, there are some little giveaways that can be helpful. So if you have had somebody phone up to make the appointment for that test on somebody else's behalf, that can sometimes be an indicator that there might be a dementia diagnosis in the mix. So, somebody phoning up and saying, oh, hey, I'd like to make an appointment for my mum, but they might not necessarily say, I'm doing this on my mum's behalf because they have cognitive impairment or dementia. Turning up on the wrong day for the appointment. I mean, admittedly, I personally am guilty of that. I literally walked into the dentist like a few weeks ago and I'd just gotten the day completely wrong. But, sometimes mix up with appointments or turning up at the wrong time or on the wrong day. Another thing that can sometimes happen is that somebody will phone the practice and say, oh, you've got these contact details on file. I'd like to change them to be my mobile number, my address. Please make sure that appointment reminder letters are addressed to me rather than this person. So that's a couple of examples of ways in which you can kind of figure out that there might be something going on. And perhaps that might actually prompt you to even ask the question of, are you making this appointment on behalf of somebody else because that person has cognitive impairment, or they might have some other kind of accessibility requirements? You can sort of phrase it like that and hopefully get a little bit more information, really.
I think from what you're saying there, the onus needs to be shared. I feel like there shouldn't be an expectation that the patient will tell you that they have dementia for the reasons that you specified earlier, whether it's stigma or just having a negative experience. And so those tips, I think, where you shift the onus a little bit on from the patient telling you or the customer telling you to you identifying a few of these things, I think are really powerful in terms of ensuring that you are going to be providing the best possible service and identifying it. Asking those questions. And is there anything else, I guess, in that light where people within a practice should look for to help better identify or address the specific needs of people with dementia? And then is there anything that they should do different once they're in the practice when they've identified it? and they know it, whether it's been told or they've been able to make some basic assumptions to at least assume that maybe this is a possibility. Should they be any different? And if so, how so?
Yeah, understood. So we have developed some resources to help people living with dementia to encourage them to actually declare that dementia diagnosis and what their likely support needs might be. So we have a booklet, which includes a double-sided card, which they can present to the practice. And on the front, it says, I have dementia. And these are the kinds of things that I might have difficulty with, for example, like energy levels or spatial vision difficulties, stuff like that. And then on the flip side of the card, there is a little checklist because, again, everyone with dementia is different. Their needs are different. Their support requirements are different. So it can be things like, I need a longer appointment, or please, can you tell me if there's any delays? Or I need somebody with me in the examination room during the appointment, just sort of stuff like that. And so that can sometimes help a little bit in terms of the structure. So we've developed these cards from our interviews with people with dementia and carers. We actually asked them what would help you. And we also asked optometrists what makes a difference to your experience of doing the eye test for people living with dementia as well. So we kind of brought all of that together into this little double-sided card. But the information booklet that comes with it also says, hey, yes, you should be having regular eye tests. It's really important. But also, please tell the practice that you have dementia because it will make a difference. There are adaptations that we can make. So, yeah, longer appointments, asking the person if they're a bit better in the mornings versus the afternoons. Sometimes the optometrists themselves may have actually sort of taken that one for the team in that regard and have actually figured out that there is a dementia diagnosis in the mix during the course of actually conducting the eye examination, which is actually quite common. They're just sort of figuring it out when that person is sat in the chair. And to be fair to people living with dementia and carers, they have the exact same, I haven't really thought about that optometrists and dispensers do when you talk to them about dementia. As far as they're concerned, the eyes and the brain are separate. Like, why would I tell the optometrist that I have a brain problem when they're doing my eye test? Like, what have these two things got to do with each other, right? So the double-sided card that we've developed is just to kind of start the conversation and to at least have a little bit of a prompt about things like support needs. So the optometrist may sometimes say, oh, can you schedule this person's appointment for just before my lunch break or as the last patient of the day, in order to give them a little bit more wiggle room in terms of testing time. If it's not, depending on the practice's structure and how appointments are booked and stuff like that, there's a lot of kind of discretion in terms of workarounds to be able to try and get those little extra bits of time, because there is no current alterations to the Medicare benefit schedule for funding eye tests for people living with dementia, even though we know that more time is helpful, or being able to split up testing over multiple visits. Again, everyone's different. There is no financial support for practices that choose to do that. And that is a separate issue, unfortunately.
Absolutely, I feel. And it sounds like it's totally warranted and needed. So I guess then the responsibility in this instance falls with the practice and their processes and systems in these situations. You've mentioned that double-sided card. I'm not sure if there's a link that we can include in the show notes that can point our listeners to that if they want to check that out and learn more about that. Cool. All right. Well, we'll get those details off you. With regards to the role of the different professions and how they need to interact with people that have dementia, if we just look at optometrists and dispensers, because they're obviously the main players in our industry, and a dispenser obviously is a pretty broad term. It's effectively anyone that works within the practice, I guess, to some extent. But the dispenser being the person who's responsible for dispensing the frame and the lenses at the point of time if it's required, what sort of things can they do in particular to ensure that they can provide a better experience for people with dementia?
Yeah, absolutely. And we are hopefully going to be having a column in Insight magazine coming up in the not too distant future on this exact topic. So do keep an eye out for that. So in terms of simple strategies, really, I think the number one thing is to assume nothing. So basically, some people with dementia may really kind of rise to the occasion of something like an eye test or going shopping for a new frame or something like that. And so actually, your kind of opening number in terms of conversations with people with dementia may actually go like pretty easily. And therefore, sometimes those signs of dementia may only start to kind of emerge as the conversation kind of progresses. And so, as a dispenser, you're kind of having this conversation with somebody, and then you only start you're about halfway through that conversation, and you're like, oh, hold on, there's something not quite as it should be here. And so you may sometimes, it is better to just assume nothing. And that also applies to whatever pair of glasses that they've brought with them as well. So mix-ups with frames are really, really common. I had somebody that I tested in the UK, and they had 11 pairs of glasses in their house in various different places. And there were a lot of them that were not theirs. They were not their prescription. So if somebody comes in with a pair and they're like, oh, I got these from the practice, assume nothing. Always look at the frame. Is this a frame that you carry? Always make sure that you optometer it to check it against whatever prescription you might have on file. That's probably like one of the really big dispensing tips that I can give. But also, just patience is like a really, really important factor. Like for person-centered care, people living with dementia do need more time. They need more time to listen. They need more time to understand what is being said and to think about how they're going to respond. And just that patience and flexibility is really, really important for both communication and also the frame selection process as well. Because making decisions can be mentally exhausting for some people living with dementia. That cognitive fatigue can be so real. If you're taking somebody to the dispensary to have a look at what's on offer and they've just been through the entire, 20 minutes, half an hour eye examination, they might actually be quite tired at that point. And it might even be worth having that conversation about, would you like to come back another time and pick out your frames then?
That came to my mind straight away. So, yeah.
Yeah, so just being flexible, being patient and being flexible is really, really important for that person-centered care. So I think those are my two kind of really top tips, but also the communication is so key. And like everybody that works in practices will have had some level of communication skills training and support, right? For people living with dementia, that clear communication is just so, so important.
Yeah. In your research and your findings, because obviously with our industry, we've got independence, obviously, and they've got a little bit of autonomy with regards to how their business is structured, and they've got flexibility. And you've got corporates that generally are working within a structure. Do you find with the research that you've done that are they both equal in terms of the service that they can provide? And do you have any take homes or any sort of points of that? Is it a factor? So with someone with dementia, and I'm not going to say better because it's just different. Is there a particular structure or ecosystem that you've seen more successful outcomes for people, for people that live with dementia?
Thanks. Yeah, it's a really interesting question. It can impact, but there are still things that you can do. So, for example, if you're working in a franchise, you might be quite restricted in what you can do in terms of the layout of your practice. You might be having to adhere to things like branding guidelines, or there's like specific visual merchandising that you need to be using. And so that can sometimes limit your options a little bit. But we're not asking everybody to suddenly manifest an interior design degree overnight. There's still some easy and simple changes that anybody can do, regardless of which practice they're in. And so, as an example of one, we had a optometrist that worked in a Specsavers practice who had completed our dementia-friendly eye care training. And one of our case scenarios is about somebody who was living with dementia, was waiting in a noisy waiting area. There was a children's play equipment very close by. And it got to the point where they were just so overwhelmed and anxious about the whole thing that when they actually got into the clinic testing room for their appointment, they were already in such a state of anxiety that they weren't able to actually complete the appointment, and they ended up getting out of the chair and just walking out of the practice because they just kind of reached their limit in the waiting area. This case scenario actually resonated quite a bit with this optometrist, and so when they went back to their practice after completing that particular case scenario, they moved the children's play equipment. So they actually moved that to the opposite end of the waiting area so that they could have a area that was a bit quieter, that people living with dementia could sit and wait to be seen.
Yeah. And I guess just goes to the point that anything can be done. It could be something as small as that's obviously mobile equipment from the point of view of the play equipment could have been lifted and moved, and it was just a simple modification, which makes all the difference, I would imagine. So I think that's a great example. We mentioned dispensers. Anything for optometrists with regards to your experience in the research that you've identified that can ensure that an optom can implement to help support patients? We've mentioned time. I think, the ability to give time, and that obviously is afforded for the dispenser as well as for the optom. But is there anything else that an optometrist can think about to support patients with dementia during their visits?
Yeah, absolutely. We actually have a training course that we've developed for optometry,
Yeah.
and
We'll speak about that too.
yeah. So that is probably like the biggest resource that we have available. But we've also run some CPD webinars with Optometry Australia about, well, it's a couple of different topics actually. So we did one about neurodegenerative diseases more generally and eye health. So you can learn a bit more about things like Parkinson's disease as well as dementia and how that can kind of impact upon eye health. But also the biggest thing for us actually was that encouraging people living with dementia to actually declare that dementia diagnosis, because when we spoke with optometrists, a lot of their challenges when working with people living with dementia were associated with not knowing the diagnosis until the person has already sat down in the chair. So a lot of these opportunities for adaptations to make that process easier for everyone involved, things like longer appointments and shifting things around in the testing room so that there can be a chair nearby for the carer, all of that kind of stuff. That those opportunities have already been and gone if the person is already sat in the chair and you're only just finding out while you're doing the case history that there's something not quite as it should be. So I think those are the two main things really. Is that training that we've developed is pretty comprehensive and will not only cover things like communication, but also people living with dementia can experience quite a lot of anxiety and agitation around eye clinic appointments. So this isn't something, again, I mentioned before about how it's not something that people living with dementia and their carers or supporters themselves are necessarily readily thinking about, because it's only the eye test, right? It shouldn't be a big deal, but it's actually that acknowledgement of actually the whole process is cognitively quite exhausting. It's just actually helping people living with dementia and carers to understand that there is things that the optometrist can do to make that eye test experience better, and it is actually worth declaring that diagnosis because it will make a difference to your eye test experience, and that difference is for the better.
And you mentioned the training course that you've developed. Can you tell us a little bit more about that course? What does it entail, and how can optometry professionals access the training and educational materials?
Yeah, absolutely. So I mentioned about that sort of anxiety and agitation. We've actually got like a dedicated module in there about the sort of the why behind it. So we call these changed behaviors, and they can actually impact on the eye examination quite significantly, especially for optometrists who are working in residential aged care, where they can be working with people who have much more advanced dementia, and therefore changed behaviors that they can witness can also include things like aggression, so verbal aggression, physical aggression. Some of the optometrists that we spoke to have had their equipment taken off them and things like that. And so how do you deal with that, and why does it happen as well? And so we worked with a behavior specialist occupational therapist to develop that module content, because when we spoke to optometrists, there were quite a few of them that said, well, it's not something that I otherwise will encounter in my day-to-day clinical practice. And therefore, when it does happen, I feel like maybe there was something I could have done to avoid it or prevent it. But because I don't have that knowledge, I feel a bit powerless when it does happen. And so that module is all about recognizing the early warning signs and also some positive de-escalation strategies to just help to potentially head that off before it turns into something like, oh, they've taken my trial frame off me and they won't give it back, or something like that. Because it can happen, and it's important to be prepared for it and to understand how you can look after your own safety as well, and how to just kind of step away from that situation or to change the environment to help that person with dementia to feel more comfortable and safe is really, really important. So we have content about that. We obviously have some information about what is dementia and how dementia can impact upon the eye examination. And then lots and lots of practical tips about communication, adapting the different aspects of the eye examination. So your subjective refraction, your objectives, the other testing that you can do, like binocular vision testing, for example. And we do also include some dispensing info in there as well. So we do actually have some tips for the optometrist to take on board with regards to the dispensing as well. And so that's a 5.5 hour CPD course. So it's pretty comprehensive. Like, You want to be doing this course if you are seeing people living with dementia on a regular basis, or if you're thinking of going into aged care optometry and would like to have a bit more in the way of tricks up your sleeve to accommodate some of the more advanced cases of dementia that you might be kind of seeing in those environments. Because in aged care, it's about 2/3 of residents that may have a dementia diagnosis of some description, because there's a lot of people living with dementia in our communities, but obviously as their care and support needs might increase over time as dementia progresses, then that point is usually the prompt that they end up in residential aged care, and therefore you do actually have quite a high proportion of people living with dementia who are making up that population of people in residential aged care. So those are the main people that I think would really benefit from completing our dementia-friendly eye care training. And for people that see people living with dementia just occasionally, maybe like once or twice a month or just very occasionally, we also have tip sheets that are available online. And they just obviously we can't condense everything about dementia-friendly eye care into an A4 sheet of paper, but we've had a go. We've had a go. That's just for people that think, I'd like to upskill a bit in this area, but I don't want to do 5.5 hours of CPD on the topic.
Yeah. What's the course called? Where can they access? How can people find this material if they're interested?
Yeah, absolutely. So basically, it is on Optometry Australia's Institute of Excellence. It's also a standalone web page that you can access as well. But if you obviously want to add it to your CPD portfolio, then you're probably best off accessing it through the Optometry Australia website. So you don't need to have Optometry Australia membership to complete it. Like, it is standalone, and there are links to the tip sheets and stuff on the main course webpage as well.
Cool. We'll put that on in the show notes as well. So if people want to find out more about what we're discussing here, they can check that out. To start to wrap it all up, I'd like to put something in maybe context of a story or a case study. I know you mentioned the case study with regards to that Specsavers store, moving the play equipment, but to those that you've seen implement dementia-friendly strategies, could you share some success stories of how practices have been able to implement these strategies, and I guess what the positive outcomes of those were?
There is a practice where they actually advertised on social media that one of their optometrists was doing our training course, and they had a person living with dementia call the practice and say, "Oh, hey, I saw on Facebook that, they wanted to make an appointment." So they actually chose the practice because they knew that there was somebody there who knew about dementia because they had undertaken that training. So if you are a practice and you are putting your staff through dementia awareness training, or you do have optometrists that are completing the training course, then it is well worth saying something about it, because people living with dementia want to be seen by an optometrist who knows about dementia. And so make it easy for them to find you, because they're out there, they need your services, and you have a really important role to play. As kind of a more real world example, really, there is another practice where I was having a chat with them, and they said, we want to make a lot of changes to our practice. And so this was we talked about the different types of practice and how that kind of impacts. So this is an independent practice, so they have a lot more kind of freedom in terms of signage and all of this, that, and the other. But they actually had a conversation with me about, wouldn't it be great if we could do some kind of, parachute people in to take a look at the practice and make those kind of recommendations about dementia-friendly environments and stuff like that. But my understanding is that they are planning to do quite a few changes with regards to things like signage, and just making it clear that this is a toilet by putting a big old sign with a picture of a toilet on it, and as opposed to the, sort of like little gender, male, female type thing, because it's just not that obvious that it's a toilet. And if you have visual perceptual difficulties, you might struggle to actually kind of correlate those two things together. So stuff like signage and changing the layout of the practice to make the reception desk for checking in for your appointment a lot more obvious, to have that very clear indicator of, I follow this path and that takes me to the front desk kind of thing. So just kind of working with some of the existing like floor layout and stuff like that. And the other thing that they've done as well is that they had one optometrist at the practice complete the course, and then they actually held a little staff meeting for a number of independent practices in the local area to cascade and share their learnings and to discuss. So again, there's just a couple of examples really, but you need to have the buy-in from your practice staff members as well. And so if you have an optometrist completing the training and they say, oh, hey, I'd like to chat to my dispensing team, I'd like to here's some examples of what helps to make a frame more dementia friendly, like spring hinges, or thinking about thinning down lenses to reduce the weight of them so that they're not irritating the skin and things like that. So I think it's just important to be receptive to those conversations, for the whole practice to be willing to just kind of get on board with that, because I think to have a dementia friendly practice as a whole, it takes everybody. It takes a village, as they say.
Yeah. Well, that's the two things that I've gotten out of what you just mentioned there is the buy-in and I think making sure the team's on board. And that's a critical thing because an optometry practice and the ecosystem of one doesn't rely on one particular area in isolation. There is a whole connection of, especially in our industry, and I say this a fefew times, there's a retail component and there's a clinical component, and there aren't many allied healthcare services out there that do combine the two. And so I feel like, you need to ensure that the dispenser and the front of staff, the front of house staff are on board, as well as the optoms and the orthoptists if they're involved and anyone else that's in that ecosystem. And that obviously is done via communication. And then the mentioning of promotion, not doing it in a negative way from the point of view of thinking, we're going to sell this, but it's more like we offer this service and we know this service is needed. We have an aging population. Dementia is becoming more common. We are more aware of it now. So promoting the fact that you actually specialize in this type of care and you understand it and you know it will in turn reap benefits for your business potentially. And that's a win-win scenario. And I think they're the sort of things that we're looking at, especially as independent practices, if I put that hat on, with regards to having a point of difference and being unique and offering something out there. And that falls into your marketing strategy and your marketing plan. And as you've alluded to, that store that actually did that is getting calls because that service is needed. And that's ultimately what we're trying to do. So I think the combination of those two, and they're closely aligned, I think is really powerful. And I think it's a bit of a take-home message for people listening today.
Yeah, 100% agree. And I think just as a final kind of closing thing in a way, it's well worth mentioning that you can now search for dementia friendly on Optometry Australia's Find an Optometrist function. We encourage people after completing our training course to update their profiles to put that on there.
Yeah.
And so
Absolutely.
If you have an optometrist at your practice that has completed dementia-friendly eye care training and has put their name on there, you may find people coming into the practice and saying, oh, can I see so-and-so? Can I have an appointment with so-and-so? Right? Again, like practice staff need to be on board with that. They need to be prepared for that likelihood that you've made it easier for people living with dementia to find you and your services. That's great. But that also means that you are going to be dealing with more people living with dementia because they really benefit from being able to access eye care. And you are now part of that solution, which is great.
Yeah, no, couldn't agree more. In summary, what are some of the key takeaways from our discussion that you want our listeners to keep in mind, I guess, after listening?
We all as eye care professionals have a part to play in dementia-friendly eye care. We need to be in a position where we are actually able to step up and to do that. It's really important because just very recently they have added untreated vision loss to the list of modifiable risk factors for dementia. So these are things that you can change about your lifestyle or where you live that can reduce your chances of developing cognitive impairment and then later on dementia. Now, what that basically means is that everybody should be having regular eye tests. We should all be having eye tests at those Medicare recommended intervals. And that includes all older adults. They should be having an eye test every year. And so we all have a part to play, not just in supporting people living with dementia, but also helping people to not develop dementia in the first place. The eye care system needs to be ready to support that. And so the least that we can all do is to learn a little bit more about dementia and about brain health in general, because we have a part to play in that ecosystem in a variety of different ways. So that's one of the key takeaways, I think. And then, so basically, no dementia. Don't put the onus on the person with dementia and their carers or supporters to educate you. So if you know a little bit, that is certainly going to go a long way.
And we definitely hope that this episode has pointed that out to a few people out there that maybe haven't been thinking about it. And it could be sort of part of that evolution too, with regards to making this more knowledgeable. Your passion for this area is infectious. I can tell that this is something that you really feel strongly about. And thank you so much for your time and for walking us through this and explaining these concepts to us. I do hope that the listeners have got a lot out of it. Where can our listeners find out more about you if they want to find out, get in touch and maybe ask you questions about this or learn more about this?
Yeah, absolutely. So you can find me on LinkedIn, and also there is a dedicated webpage on Dementia Australia's National Library Guide. It's got lots and lots of information about dementia, but you can read all about dementia and eye health on there, and that's got basically links to everything that we've produced as part of this research project as a whole.
Nice. Well, we'll definitely have those links in our show notes, as well as the other ones that we've mentioned throughout the episode today. Marianne, thank you so much for your time. I really appreciate it. It's been an absolute delight having you on the podcast today.
Thank you so much. And again, it's a pleasure to have been invited to come and present. And I really hope that this will get people thinking and talking about dementia and the role that we all have to play in helping people living with dementia see well to live well.
Stay connected by subscribing to The Focused View and visiting our website www.thefocusedview.com.au for additional resources and episode summaries. We look forward to your company again in our next episode. Until then, keep focused. I'm Michael Nasser. Bye for now.